Hello guys, welcome to my channel Twastramanas.
In this video we are going to see the other 6 types of counseling. 7. Mental health. 8. Child and adolescent counseling. 9. Grief counseling. 10. Trauma counseling. 11. School counseling and 12. Crisis counseling. School counseling, stages, models, and tools. School counseling is a vital component of the educational system, providing essential support to students in their academic, personal, social, and career development. Effective school counseling involves understanding and implementing various stages, models, and tools to address the diverse needs of students. This comprehensive guide explores these elements in detail, providing relevant examples to illustrate their application. Stages of school counseling. 1. Initial assessment. The initial assessment stage involves gathering information about the student's background, current issues, and overall well-being. This can be done through interviews, questionnaires, and observations. Example: a school counselor might meet with a student who is struggling academically and has recently shown signs of social withdrawal. During the initial assessment, the counselor gathers information from the student, teachers, and parents to understand the root cause of the problem. 2. Goal setting. After the initial assessment, the counselor and the student set specific, measurable, achievable, relevant, and time-bound, SMART goals. These goals guide the counseling process and provide a clear direction for the interventions. Example: a student experiencing anxiety about upcoming exams might set a goal to learn and practice 3 relaxation techniques within the next month to help manage stress. 3. Intervention planning. In this stage, the counselor develops a tailored intervention plan based on the student's unique needs and goals. This plan may include individual counseling sessions, group therapy, or referrals to external resources. Example: a student dealing with bullying might have a plan that includes weekly individual counseling sessions to build self-esteem, a peer support group, and collaboration with teachers to address the bullying behavior. 4. Implementation. The implementation stage involves putting the intervention plan into action. The counselor works closely with the student, providing support and guidance throughout the process. Example: for a student struggling with time management, the counselor might conduct weekly sessions to teach organizational skills, monitor the student's progress, and adjust strategies as needed. 5. Evaluation and review. The final stage involves evaluating the effectiveness of the interventions and reviewing the students' progress towards their goals. Adjustments to the intervention plan may be made based on this evaluation. Example: a counselor reviews the progress of a student who set goals to improve social skills. They assess whether the student has become more engaged in group activities and less isolated, making any necessary adjustments to the intervention plan. Models of school counseling. 1. The comprehensive developmental school counseling model. This model emphasizes the developmental needs of students and integrates academic, career, and personal, social development into the counseling program. It is proactive and preventative, designed to promote student success. Example: a school implements a comprehensive counseling program that includes classroom lessons on study skills, career exploration workshops, and peer mediation programs to address conflicts. 2. Solution-focused brief counseling, SFBC. SFBC is a short-term, goal-oriented approach that focuses on solutions rather than problems. It helps students identify their strengths and resources to overcome challenges. Example: a counselor working with a student who has low motivation in school uses SFBC techniques to help the student identify past successes, set achievable goals, and develop a plan to increase motivation. 3. Cognitive behavioral therapy, CBT. CBT is a widely used model in school counseling that addresses negative thought patterns and behaviors. It helps students develop coping skills and strategies to manage their emotions and behaviors. Example: a student with test anxiety might work with a counselor using CBT to identify and challenge negative thoughts about their abilities, learn relaxation techniques, and practice positive self-talk. 4. Person-centered counseling. This model, developed by Carl Rogers, focuses on creating a supportive and non-judgmental environment where students feel valued and understood. It emphasizes the importance of empathy, unconditional positive regard, and congruence. Example: A counselor uses a person-centered approach to help a student experiencing family issues. The counselor provides a safe space for the student to express their feelings and works collaboratively to explore solutions. Tools of school counseling. 1. Assessment tools. Assessment tools help counselors gather information about students' academic performance, emotional well-being, and social skills. These tools can include standardized tests, surveys, and behavioral checklists. Example: a school counselor uses the Beck Depression Inventory, BDI, to assess the severity of depressive symptoms in a student who has been showing signs of depression. 2. Counseling techniques. Counseling techniques are specific methods used during sessions to facilitate communication and support students. Techniques can include active listening, open-ended questions, and role-playing. Example: during a session with a student struggling with peer relationships, the counselor uses role-playing to help the student practice assertive communication skills. 3. Technology and digital tools. Technology can enhance the counseling process by providing resources and tools for both counselors and students. These can include online assessment tools, virtual counseling sessions, and educational apps. Example: a school counselor uses an app like Calm to teach students mindfulness and relaxation techniques that they can practice at home. 4. Referral systems. Referral systems are essential for connecting students with additional resources and support outside the school. This can include mental health services, community programs, and specialist providers. Example: a student with severe anxiety might be referred to an external mental health professional for specialized treatment, while the school counselor continues to provide ongoing support and coordination. 5. Group counseling. Group counseling allows students to share experiences and support each other under the guidance of a counselor. It can address common issues such as social skills, grief, and stress management. Example: a school counselor facilitates a group for students who have experienced loss. In the group, students share their experiences, learn coping strategies, and support one another in their grief journey. Conclusion: school counseling is a multifaceted process that requires a comprehensive understanding of the stages, models, and tools involved. By effectively assessing students, setting goals, planning and implementing interventions, and evaluating progress, school counselors can provide crucial support that enhances students' academic and personal development. Using various models such as the Comprehensive Developmental School Counseling Model, Solution-Focused Brief Counseling, Cognitive Behavioral Therapy, and Person-Centered Counseling, counselors can address a wide range of student needs. Additionally, the use of assessment tools, counseling techniques, technology, referral systems, and group counseling can further enhance the effectiveness of school counseling programs. Through these efforts, school counselors play a pivotal role in fostering a supportive and thriving school environment. Crisis counseling, stages, models, and tools. Crisis counseling is a specialized field aimed at helping individuals who are experiencing an acute psychological crisis. The goal is to provide immediate, short-term assistance to help individuals regain their equilibrium and cope with the crisis. This type of counseling involves several stages, models, and tools designed to support individuals effectively. Stages of crisis counseling. 1. Assessment. The first stage involves evaluating the individual's situation to understand the nature and severity of the crisis. This includes assessing the individual's mental state, risk factors, and immediate needs. Example: a counselor meets with a client who has just experienced a traumatic event, such as the sudden death of a loved one. The counselor asks questions to understand the client's emotional state, their support system, and any immediate threats to their safety, such as suicidal thoughts. 2. Establishing rapport. Building a trusting relationship is crucial for effective counseling. The counselor must create a safe, non-judgmental environment where the individual feels heard and supported. Example: during the first session, the counselor listens empathetically, validates the client's feelings, and assures them that it is okay to express their emotions. This helps the client feel understood and begins to build trust. 3. Identifying the major problems. Pinpointing the specific issues that are contributing to the crisis is essential. This helps in focusing the counseling sessions and creating a targeted intervention plan. Example: The client is overwhelmed by multiple stressors, including job loss, relationship issues, and health concerns. The counselor helps the client prioritize these issues and identify the most pressing problem that needs immediate attention. 4. Dealing with emotions. The individual must be allowed to express their emotions in a safe space. The counselor helps the client understand and process these emotions, which is a critical step towards healing. Example: the client expresses feelings of anger and sadness related to their loss. The counselor encourages the client to talk about their emotions and provides techniques for managing intense feelings, such as deep breathing exercises or journaling. 5. Exploring alternatives. The counselor works with the client to identify potential solutions and coping strategies. This stage involves brainstorming and evaluating different options to address the crisis. Example: the counselor and client discuss possible steps to improve the client's situation, such as seeking financial assistance, reaching out to supportive friends or family members, and engaging in self-care activities. 6. Formulating an action plan. Developing a concrete plan of action helps the client feel more in control and focused. The plan should include specific, achievable steps that the client can take to address their crisis. Example: the action plan might include scheduling an appointment with a financial advisor, joining a support group, and setting small daily goals to enhance the client's sense of accomplishment. 7. Follow-up. Ensuring that the client continues to receive support is important for long-term recovery. Follow-up sessions help the counselor monitor progress and make any necessary adjustments to the intervention plan. Example: the counselor schedules a follow-up session for the following week to check on the client's progress, offer additional support, and adjust the action plan as needed. Models of crisis counseling. 1. Roberts' 7-stage crisis intervention model. This model is widely used and encompasses the stages mentioned above, emphasizing a structured approach to crisis intervention. 2. ABC model of crisis intervention. This model focuses on 3 main components. A. Achieving contact with the person in crisis. B. Boiling down the problem to its essentials. C. Coping strategies are developed to help the person manage their crisis. 3. Gilliland's 6-step model. This model outlines 6 steps, defining the problem, ensuring client safety, providing support, examining alternatives, making plans, obtaining commitment. Tools used in crisis counseling. 1. Active listening. This tool involves fully concentrating, understanding, responding, and remembering what the client is saying. It helps build rapport and trust. Example: the counselor uses active listening techniques such as nodding, maintaining eye contact, and summarizing what the client says to ensure they feel heard. 2. Empathy and validation. Expressing empathy and validating the client's feelings are crucial in making them feel understood and supported. Example: the counselor says, "I can see how this situation is incredibly painful for you. It's understandable that you're feeling overwhelmed." 3. Safety planning. This tool is used to ensure the client's immediate safety, especially if there are risks of self-harm or harm to others. Example: the counselor works with the client to create a safety plan that includes removing dangerous objects from their environment, identifying safe places, and having emergency contacts readily available. 4. Cognitive behavioral techniques. These techniques help clients identify and challenge negative thought patterns and develop healthier ways of thinking. Example: the counselor helps the client identify irrational thoughts contributing to their anxiety and teaches them how to reframe these thoughts more positively. 5. Grounding techniques. These techniques help clients stay present and reduce anxiety during a crisis. Example: the counselor guides the client through a grounding exercise, such as the 5, 4, 3, 2, 1 technique, which involves identifying 5 things they can see, 4 things they can touch, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. Detailed example of crisis counseling in action. Jana, a 30-year-old woman, experiences a severe panic attack after losing her job unexpectedly. She feels hopeless, unable to cope, and is considering self-harm. 1. Assessment. The counselor meets with Jana and assesses her mental state, including the intensity of her panic, her thoughts of self-harm, and her immediate needs for support. 2. Establishing rapport. The counselor creates a safe space for Jana to express her feelings without judgment, using active listening and empathetic responses to build trust. 3. Identifying the major problems. Jana reveals that her job loss has triggered financial insecurity, fear of the future, and feelings of worthlessness. The counselor helps Jana prioritize these issues. 4. Dealing with emotions. Jana is encouraged to talk about her feelings of fear and hopelessness. The counselor validates her emotions and introduces techniques to manage her anxiety, such as deep breathing and mindfulness exercises. 5. Exploring alternatives. The counselor and Jana brainstorm potential solutions, such as updating her resume, applying for unemployment benefits, and reaching out to her professional network for job leads. 6. Formulating an action plan. They develop a step-by-step plan that includes daily job search activities, attending networking events, and practicing self-care routines to reduce stress. 7. Follow-up. The counselor schedules a follow-up session to check on Jana's progress, adjust the action plan as needed, and provide ongoing support. In conclusion, crisis counseling involves a systematic approach to help individuals navigate through their crises effectively. By understanding the stages, models, and tools involved, counselors can provide targeted support and empower clients to regain stability and resilience. So these are the types of counseling which are very important, and it will help you guys as counselor to understand and acknowledge the clients, loved ones, friends. Counseling is a vital component of mental health care, providing individuals with the tools and support necessary to navigate life's challenges. Different types of counseling, such as cognitive behavioral therapy, CBT, psychodynamic therapy, humanistic therapy, and others, each offer unique approaches tailored to diverse needs and issues. The variety in counseling types ensures that treatment can be customized to address specific conditions such as anxiety, depression, trauma, relationship issues, and more. For instance, CBT focuses on identifying and changing negative thought patterns, which can be highly effective for those struggling with anxiety or depression. On the other hand, psychodynamic therapy delves into unconscious processes and past experiences, offering deep insights for individuals dealing with long-standing emotional conflicts. Humanistic therapy emphasizes personal growth and self-actualization, supporting clients in finding their true potential and purpose. Additionally, specialized forms of counseling, like marriage and family therapy, address relational dynamics and enhance communication among family members, while career counseling helps individuals identify their professional strengths and navigate career transitions. The availability of various counseling methods allows therapists to adopt an integrative approach, combining techniques from different therapies to best suit the client's needs. This adaptability not only enhances the efficacy of treatment but also respects the unique experiences and preferences of each individual, fostering a more personalized and effective healing process. Overall, the diverse array of counseling types plays a crucial role in ensuring comprehensive mental health care, offering hope and practical solutions to those in need. Models are essential in counseling because they provide a structured framework that guides the therapeutic process, ensuring that interventions are systematic and evidence-based. These models help counselors to understand the complexities of human behavior, emotions, and thoughts, offering a map to navigate the intricacies of a client's experiences and challenges. By adhering to established models, counselors can maintain consistency in their approach, which enhances the reliability and effectiveness of the therapy provided. This structure is particularly crucial in developing treatment plans tailored to individual needs, as models often include various techniques and strategies proven to address specific issues such as anxiety, depression, trauma, or relationship difficulties. Moreover, models in counseling offer a common language and set of concepts that facilitate communication among professionals. This shared understanding is vital for collaboration and supervision, allowing counselors to discuss cases, share insights, and seek advice more efficiently. For novice counselors, models serve as educational tools that provide a clear outline of therapeutic stages, goals, and expected outcomes, thereby reducing the ambiguity and uncertainty that can accompany the counseling process. In addition, models enable counselors to evaluate their practice and measure client progress effectively. They provide benchmarks against which the counselor can assess whether the therapeutic interventions are working and make necessary adjustments. This evaluative aspect is critical in ensuring that the counseling remains dynamic and responsive to the client's evolving needs. Furthermore, adherence to a counseling model enhances the counselor's credibility and professionalism. Clients are often reassured when they know their counselor follows a reputable and established framework, as it suggests competence and a commitment to best practices. This trust is foundational to the therapeutic alliance, which is a key determinant of successful outcomes in counseling. Overall, counseling models are indispensable as they offer a comprehensive guide that aids counselors in delivering consistent, effective, and ethical care. They foster professional development, improve client outcomes, and ensure that counseling practices remain grounded in theory and research. This structured approach is essential in navigating the complex landscape of human psychology, ultimately helping clients to achieve their personal goals and improve their mental health and well-being. Tools are of paramount importance in counseling as they equip counselors with a diverse array of resources to effectively address the varied and complex needs of their clients. These tools encompass a wide range of instruments, including assessment questionnaires, therapeutic worksheets, digital apps, biofeedback devices, and creative aids like art supplies and journals. The utilization of these tools enhances the counselor's ability to gather comprehensive information about the client's mental health status, identify specific issues, and track progress over time. For instance, assessment tools can provide objective data that aids in diagnosing conditions such as anxiety, depression, or PTSD, enabling the counselor to tailor interventions more precisely. Moreover, tools in counseling serve to facilitate communication and expression, especially for clients who may find it challenging to articulate their thoughts and feelings verbally. Techniques such as art therapy, music therapy, and play therapy provide alternative avenues for self-expression, making therapy more accessible and engaging, particularly for children and individuals with communication difficulties. These tools can help uncover underlying issues that might not surface through traditional talk therapy alone. In addition, digital tools and apps have revolutionized the counseling landscape by offering new ways to support clients outside of face-to-face sessions. Apps designed for mental health can provide clients with resources for self-monitoring, coping strategies, and mindfulness practices, thereby extending the therapeutic process beyond the counseling room. These tools empower clients to take an active role in their own mental health management, fostering a sense of autonomy and continuous engagement in their healing journey. For counselors, tools also play a crucial role in enhancing professional efficiency and effectiveness. Electronic health records, EHR, and client management software streamline administrative tasks, such as scheduling, note-taking, and billing, allowing counselors to dedicate more time and focus to direct client care. Furthermore, tools for self-care and professional development, such as supervision apps and training platforms, support counselors in maintaining their own well-being and staying updated with the latest advancements in the field. Biofeedback devices, which measure physiological responses like heart rate and skin conductance, provide real-time data that can be used to teach clients about the connection between their physical and emotional states. This tangible evidence can be particularly impactful in helping clients understand and manage symptoms of stress and anxiety, as they can see the direct impact of relaxation techniques on their bodily responses. Additionally, tools designed for specific therapeutic approaches, such as cognitive behavioral therapy, CBT, workbooks and dialectical behavior therapy, DBT, skills training manuals, offer structured and evidence-based exercises that guide the therapeutic process. These resources help ensure that interventions are consistent and grounded in proven methodologies, enhancing the overall efficacy of treatment. Overall, the integration of various tools into counseling practices enriches the therapeutic experience, making it more adaptable, efficient, and effective. They provide counselors with valuable insights, support client engagement and self-management, streamline administrative processes, and offer alternative methods of expression and intervention. This multifaceted support ultimately contributes to better outcomes for clients and a more robust and responsive counseling practice. Counseling is a professional service aimed at helping individuals manage and overcome personal, social, and psychological challenges. It involves a trained counselor who provides support, guidance, and interventions based on a structured framework to promote mental health and well-being. However, Friends and family members can also play a crucial role in supporting their loved ones through informal counseling, although they do not replace the need for professional help. Understanding the nuances of counseling and the ways in which friends and family can contribute is essential for providing effective support. Understanding counseling. Counseling is built on the foundation of trust, confidentiality, and empathy. Professional counselors are trained to use various therapeutic techniques to help clients explore their thoughts, feelings, and behaviors. They aim to foster a safe and non-judgmental environment where clients can openly discuss their issues. The goals of counseling can vary widely, from resolving specific problems like anxiety or depression to improving relationships and coping with life transitions. Key elements of counseling include 1. Active listening. Counselors listen attentively without interrupting, showing empathy and understanding. 2. Reflective listening. They paraphrase and reflect back what the client says to ensure understanding and validation. 3. Goal setting. Together with the client, counselors set achievable goals to work towards during sessions. 4. Intervention strategies. They use evidence-based techniques, such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and mindfulness. 5. Confidentiality. Maintaining confidentiality is critical, except in cases where there is a risk of harm to the client or others. The role of friends and family in counseling. Friends and family members can provide substantial support to their loved ones by adopting some counseling principles, even without formal training. Here are ways they can help. 1. Creating a safe space. Just like professional counselors, friends and family can offer a safe, non-judgmental environment where the person feels comfortable sharing their thoughts and feelings. This involves being present, listening actively, and showing empathy. 2. Active listening. Pay full attention to the person speaking, avoiding interruptions. Show that you are engaged through nodding, maintaining eye contact, and using verbal affirmations like, "I see," or, "That sounds tough." 3. Empathy and validation. Acknowledge their feelings without judgment. Phrases like, "I can see why you feel that way," or, "It's okay to feel upset," can be very validating. 4. Encouraging professional help. Recognize the limits of what you can offer and encourage them to seek professional counseling if needed. Sometimes, friends and family can help by finding resources or even accompanying them to appointments. 5. Practical support. Help them with daily tasks that might feel overwhelming, such as cooking, cleaning, or managing appointments, to reduce their stress and allow them to focus on their mental health. 6. Being patient and consistent. Mental health struggles can be long-term and non-linear. Patience and consistent support are crucial, even on days when progress seems slow or non-existent. Conclusion. While professional counseling is irreplaceable for addressing complex mental health issues, friends and family can significantly support their loved ones through informal counseling practices. By creating a safe and empathetic environment, actively listening, validating feelings, and encouraging professional help, they can provide much-needed support. Real-life examples demonstrate the profound impact that such support can have, highlighting the importance of patience, consistency, and practical assistance. Ultimately, the collaborative effort between professional counselors and supportive friends and family members can lead to more holistic and effective mental health care. Counseling can be tough in some parts, but with proper help, understanding, and guidance, you can achieve positive results from it and help your loved ones and friends.
Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.